Hey Coastline community, welcome to the Chiropractic Masterclass, and we're going to be going over a brief Chiropractic Masterclass and the benefits of incorporating routine chiropractic care into your health routine and how it will help you in more ways than you know. And majority of people, when they think about chiropractic care, they think about, I'm in pain, I go to the chiropractor, I'll come in, I'll get adjusted, and I'll feel better, and then I'll get in my car and I'll go home. But chiropractic care is much more than that, and research shows that chiropractic care also improves heart rate variability, promotes healthy immune function, which is also why we encourage you as a patient when you are not feeling well to come in and get adjusted. And when we are not feeling well, we may think to take our vitamins and minerals to stay away from sugar and alcohol and dairy and all the other things that make us sick, along with getting plenty of rest to accelerate our healing time. Chiropractic care needs to be part of that protocol as well, and it sets our body up in the best environment to heal and overcome whatever it is that your body is going through. And chiropractic care also decreases cortisol levels by activating a parasympathetic response in the body. And what is a parasympathetic response in the body? You have two different wirings in your nervous system. You have a sympathetic nervous system, which is your fight or flight. Think about this is your stress or gotta get things done or got to get out of a situation nervous system. It's your go, go, go nervous system. Then you have your parasympathetic nervous system, and there is a time and place for both. But I will tell you, majority of Americans, and this may be you, may operate, and majority of Americans do operate in what's called a sympathetic dominant state of being, meaning they're constantly stressed, they're constantly wired, they're constantly going, but there needs to be a balance between sympathetic nervous system drive and parasympathetic nervous drive. Sympathetic nervous drive, if it's not able to turn off, meaning we're not able to de-stress, we're not able to relax, and we're constantly in go, 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 that's going to lead to higher cortisol, higher stress, higher health issue complication percentage rate, versus we need to have a time and place for that and a time to turn on parasympathetic. But chiropractic adjustments activate a parasympathetic response in the body, which is great. So it takes our body and brain out of a state of fight or flight or the chronic stress state that many of us find ourselves in the world today. So chiropractic care also shows to improve sleep and reduces inflammation, not to mention by aligning, mobilizing, and decompressing the spine, we are offsetting daily stressors that we endure through gravity, like sleeping wrong, sitting at a desk for hours at a time, pressure endured while at work or exercising, and the wear and tear on our joints and discs, they can compound over time. Just like we talked about, there's a balance between sympathetic state of being and parasympathetic state of being. There's a time and place for both. They balance each other out. We need to think about the compressive forces on our body as a compounding where they need to be decompressed in time as well. Because if you only have compressive forces on the spine, that will compound, meaning we're going to end up with arthritis and degeneration, more pain. You can even lose height and start to have dysfunctional biomechanics. Versus at the end of the day, in the beginning of the day, we need to decompress the spine and add in routine chiropractic adjustments. And a golden nugget here is to think about in comparison, each and every day we wake up and we brush our teeth, and that's a given. It should be. But we eat, we drink, we chew food, and each and every night we brush and floss our teeth to make sure that our teeth do not accumulate plaque and bacteria that, if left there, would break our teeth down and leave us with things like cavities and other issues that would need to be dealt with. And by not brushing our teeth and flossing our teeth, we can expect that over time that we will have oral hygiene problems. Although your spine may not be chewing and eating food, our spine requires daily maintenance as well. And if you think about it, it makes a lot of sense. Our spine is the main structure of our body. It's also the most important structure. So our spine is what keeps us upright. It determines how we move, and it sets the groundwork for the rest of our biomechanics. And most importantly, our spine's main function is to protect our central nervous system. And that is the system that controls and coordinates every other function in our body. And our central nervous system is made up of our brain and our spinal cord, and it is so important that the body has created a protection around that nervous system. So we have a full helmet that protects our skull, that protects our brain, called our skull, and we also have a full spine that protects our spinal cord and all the nerve roots that exit. So when your spine is healthy and it's in alignment and it's moving without friction or restriction, the body is happy. And that's when our body really does best. But when the spine has a misalignment, not only is that painful and debilitating, but it also interferes with your central nervous system and how the brain and body communicate together. And that's because chiropractic adjustments work like clearing static off of a radio station. So when we reduce the interference, meaning we realign the spine, the signal from the brain to the body gets clearer and more efficient. And chiropractic adjustments actually stimulates the brain's prefrontal cortex, which is your brain's executive center. So it also regulates focus, emotional control, immune regulation, and motor planning. And research also shows that chiropractic care increases brain drive to your core muscles within 20 minutes of a chiropractic care adjustment. And so chiropractic care is not just about pain relief. It's also about cortical reprogramming. So not only is chiropractic care great for reducing pain, but you do not need to be a chiropractic patient only when you are dealing with pain. And it's one of the most powerful health and wellness tools that exists on earth today. So something that we need to look at here is when your pain that you're dealing with is minimized or goes away completely, routine chiropractic care in your routine helps maintain balance, offsets daily pressure on the joints and discs, improves performance so that you can live a life to the highest functionality possible. And that's why after a corrective chiropractic plan is completed, we emphasize and encourage you to continue with maintenance care, not only just to maintain progress from all the work that you've put in, but also to keep your body healthy and well for the rest of your life. And remember, health is not something that you get, it's something that you do. It's a daily practice, and every season of life brings its challenges. And maintenance adjustments allows for your body to adapt through those seasons instead of getting worn down and left with health issues. And then 4, 5, 6, 7 years later, you come back in with old issues that could have just been maintained or overcome by keeping up with maintenance adjustments. And that's what we look at here. So majority of people, when they come into the clinic, they're dealing with some type of pain, whether it be neck pain, lower back pain, pain into the shoulders, or sciatica. And what we encourage patients to do is as you go through this, we want to take the high road. So as we go through corrective chiropractic care, we're working on this green path. So that way spinal issues and biomechanical issues and pain and dysfunctional movements can become a thing of the past. We don't want to get all the way up here and functioning at our best and then just decide to come in and get adjusted only when we are in pain. And in a corrective phase, you are getting adjusted more frequently for the body to adapt to your new position. And as time goes on, you do not need to be in here 2 or 3 times a week. That's why we encourage you keep up with the spinal exercises that have been prescribed to you at home. But then afterwards, maintenance is very simple, whether if you're coming in once a week, every other week, something that helps keep your body in alignment instead of reverting back down into the pain cycle and then getting adjusted just when you are in pain. Think about it as we do not go to the dentist when we have a cavity or when we have an issue with our teeth or our oral hygiene. We brush and we floss our teeth each and every day, and we go for routine maintenance checkups so that our teeth stay healthy and well as time goes on. And that's why we've incorporated powerful chiropractic additions into our clinic to help optimize your care and outcome with treatment. Starting with the spinal cushions that we wobble and move on, 92% of the nutrients that go to your brain are facilitated through a process called imbibition. So think about imbibition as wringing out a sponge and allowing new water to fill that sponge and repeating the process. So the sponge will always have fresh water and the sponge is ready to perform its job. The spine is the same way. So as we move on the spinal cushion, we're also facilitating nutrients up and down your spinal cord and into the brain, along with activating synovial fluid. And that's the fluid that lines your spinal joints and keeps them lubricated and ready for movement. When the body becomes very sedentary or stagnant and we're not facilitating that synovial fluid in the joints, think about the joint as a rusty hinge. A well-lubricated joint is going to move much smoother and efficiently versus a rusty hinge that is dysfunctional and has the possibility to break. And for that analogy, we're looking at it as a break of that hinge to be an injury to the body. And as we move up and down, left to right, side to side, we are receiving many different benefits at once. And to start, we're training the brain and body to move together and facilitating that range of motion that we are achieving, then letting the body know that those ranges of motion that we're getting, they are safe, they are effective, which in return when we go out of the clinic and into our everyday life, that the body is already prepared to sustain those types of movements. So things like getting in and out of a car, putting your shoes and socks on, swinging a golf club, or picking up a child or grandchild, or even dancing is possible. And this also sets us up for success to get the most out of the chiropractic adjustment. So if you think about it, there's a big difference from waking up in the morning, driving in the car, going to work, back into the car, and then if you were to come just straight into the clinic and lay straight on the chiropractic table after a long day with no warm up and expect to get the most out of the chiropractic adjustment, it's just not possible compared to moving, stretching, and rehydrating the spine with spinal warm-ups prior to the chiropractic adjustment. And then by laying face down on the table, it allows for the spine to enter the position with the least amount of pressure possible and sets your spine up for success. So if we look over at this chart, this is just depicting positions that influence discal pressure. So the least amount of discal pressure or spinal pressure that your body can have is when you are laying face down or face up. The second most is when you are standing. The third is when you are sitting. The more forward that you sit, which a lot of us find ourselves in this position, we are increasing discal pressure by 190%. So we talk about those compounding forces over time. If you are sitting at a desk for 8 to 10 hours a day and you're never decompressing or mobilizing or aligning the spine, this is why that old person posture is such a thing. We expect to have rounded shoulders, to have that shuffling gait, versus if you keep up with a spinal care routine throughout your life, you can be 70 and 80 and still kicking butt because you've set your spine up for success to be able to do that. And the cervical traction unit is a key part of the pre-adjustment preparation. And the curvature in the neck, also coined by neurologists as the arc of life. And as we know it, the spine also has another curve in the middle of the back and the lower back. So why would neurologists call the arc in the neck the arc of life? Well, I'll give you a hint. So if the neck's right up here, right, we have two other arcs. We have an arc in the middle back and we have an arc in the lower back. Why would neurologists term this curve right here? Why do they call that one the arc of life? Think about what it's closest to, right? It's closest to the brain. And the brain has to send messages through these group of nerves in the neck first to communicate through the rest of the body. So when we talk about decompressing and also mobilizing the cervical tissue and joints, that's why we want to go through that exercise prior to the chiropractic adjustment. And in this visualization, what we're showing right here is the brain has to communicate down through these channel of nerves first for the body and brain to communicate clearly. So we like to see a 30 to a 45 degree curve, and the cervical curve should optimally measure 45 degrees lordotic, like a backwards C shape right here. And the strongest angle in nature is also 45 degrees. So it's pretty amazing to see that the most optimal structure of the human spine is when the spine is straight up and down from the front, but also from the side, we have 3 45 degree curves in the neck, middle back, and lower back. And the cervical traction unit facilitates decompression in the neck, which removes pressure and also hydrates joints and discs, while also helping to align and reinforce proper structure within the spine. And as we bend down at this rehab station, the traction unit will pull up on our neck and put us into extension here, removing tension and pressure on the spinal cord, muscles, and ligaments. And in today's society, I'm sure that you've probably heard of the tech neck phenomenon, which comes from hundreds to thousands of hours looking down at technology, which leads to a tight neck and shoulders and muscles and forward head posture. And in advanced stages, leave people with the hunch at the top of their neck or that little hump that we start to see. So the cervical traction unit is the perfect balance for tech neck. Next, we have spinal decompression therapy, and decompression therapy is a titan of a spinal treatment device. And our spine is the main structure in our body, and we put our spine through a lot of responsibility in a lifetime. Gravity is constant, stressors are constant, and our body's always working to adapt to the environment that we are in because we are constantly undergoing compressive forces that we have to take into account, like sitting, walking, standing, working, and exercising. They all add up and compound over time. But if the compressive forces that we endure become too much or are never released replaced or treated, we see common issues like pinched nerves, muscle aches and pains, painful movement, and in the more severe cases, arthritis, disc injuries, and degeneration. But by adding decompression therapy, we are able to offset the compressive forces that the spine takes on. This is also a powerful therapy in stretching the soft tissue in the spine, aiding in disc restoration and hydration, along with relieving pressure on the joints in the spine. And this also allows you to move more freely. So what we can look at over here is as the spine compresses, right, from daily stressors, constant gravity, working, exercising, we put constant force, which brings our spine closer together. With decompression therapy, we are aiding in the spine in the least amount of discal pressure while we're laying down, and we're opening up those spinal joints because the bones themselves, they have blood flow to them. So they have a constant reservoir of nutrition and healing, but the disc spaces, they're what's called avascular. So they do not have a direct blood supply. So if there is a prolonged compression force that stays there, you will wear out that disc in between. With decompression therapy, movements, adjustments, and aligning the spine, we get to decompress those joints, allowing the proteoglycans and the fluid to go back into that disc space, taking the pressure, because what comes out between the bones and the disc, right through this segment here, we have nerve roots that come out. So when we're compressed, that's why you get the pain in the neck, in the shoulders, going down into the leg or the lower back. But when we open that up, we're giving that nerve more space to breathe and less pressure so that it can function properly. And last but not least, we have vibration therapy. And vibration therapy is one of the most powerful stimuli that the nervous system can detect. And vibration therapy also has many benefits such as muscle stimulation, improving circulation, and enhancing recovery. It also helps reduce muscle soreness, increase flexibility, and it boosts lymphatic drainage, making it ideal for post-workout recovery or chronic pain management. And regular use of vibration therapy can also improve balance, coordination, bone density, especially in older adults, those limited with mobility. And vibration therapy has been shown to stimulate the nervous system and increase blood flow, which accelerates healing and reduces inflammation in injured or overworked areas in the body. And at Coastline Spine Health Center, we use vibration therapy to complement chiropractic care and support faster, more effective results by re-educating the nervous system to help you move, feel, and live better. So that way, when you go back into your car, you don't just fall back out of alignment. So we encourage you, make the most out of the spinal amenities that we have here. And we brought them into the clinic for you to get the most use out of them. And remember, stay on top of your daily exercises that have been prescribed to you. And when you're doing these at home, these will prepare your spine for the day and will also help you decompress at the end of the day. So that way you can get the most efficient sleep possible. And if you enjoyed this video, you can log on to our YouTube channel and send to a loved one if this will help them as well. And thanks for watching. We'll see you in the adjustment rooms very soon.